Good morning, everyone. This is Jim Manker with CSAC Finance Corporation. Wanted to just let you know you're in the right spot. We're going to get going on the Anthem's C19 Explorer tool webinar shortly. We'll wait another minute or so, but you're in the right spot. Just make sure that your microphone, well, we have you on mute, but make sure that your volume's up so you can hear everything and that you can see something on the screen. Right now, we just have a title screen there, and we'll get going here in about a minute. All right, we're going to go ahead and kick this off in about 30 seconds. So we see that there are more of you on the line with us, and that's great. This is Jim Manker talking from the CSAC Finance Corporation, and we'll kick this off here in about 30 seconds. All right, good morning, everyone. This is Jim Manker with the CSAC Finance Corporation. That's the California State Association of Counties Finance Corporation. And I want to welcome you to our webinar this morning, Help Data for COVID Recovery Decision Making, a snapshot of Anthem's C19 Explorer tool. We're glad to have you. We're doing this webinar in partnership with the Institute of Local Government and of course, one of our platinum partners at CSAC, and that's Anthem. And we're just thankful for the partnership we've had with them for many years. They just bring so much value to our organization, to counties, to cities, to really just the whole nation. And so we're thankful that they're with us today and their expertise. I'm going to kick it over to really the backbone of this webinar, and that's Randy K. Stevens, my colleague at the Institute of Local Government, and she'll talk through how we're going to manage this webinar today and how to ask questions and things like that. So again, thank you for joining us. We're glad you're here, and I'll turn it over to you now, Randy.
Thank you, Jim. Thank you, Jim. So glad to be here. And thank you to Anthem and to CSAC for this opportunity to share about the COVID tool that Anthem has created. We hope today's webinar is extremely interactive and provides opportunity for our officials with counties, cities, and special districts to really understand how this critical information can be used for their benefit in their local communities. I see we've got quite a group of attendees from a variety of jurisdictions all over California, and this is absolutely incredible to see all these folks here to learn about the Anthem tool today. Jim, thank you for giving us the overview of the webinar and sharing who our partners are here today. I'm going to go ahead and get to the information about what we're doing. We are going to hear directly from the creators of this powerful tool, the team at Anthem, as well as their team at CloudMedX. And we're going to be able to ask questions directly of the creators and the team behind the tool. So this webinar is for you and for you to have access to the information you're looking for. So please go ahead and feel free to ask questions during the webinar using the Q&A box. Since you are on mute, we do need you to go ahead and type in your questions And we will verbally ask your questions to the presenters in real time so that they can provide you with the answer you're looking for. And typically, we would hold questions to the end for standard presentations, but this is intended to be highly interactive. Again, the Institute for Local Government is proud to be here supporting both Anthem and CSAC. We are the education and nonprofit training affiliate to CSAC, as well as to the League of Cities and Special Districts Association. We do have a variety of resources that we welcome you to access. They are complimentary and online at our website. And I do appreciate this opportunity to help provide health information, especially in this critical time of COVID. We do have a number of resources related to connecting with your public and how to really kind of share that broader COVID information on our website. We welcome you to have access to. And certainly, we want to recommend that you attend or visit the county's website for COVID resources. And the League, as well as CSDA, has a similar site with information for local officials. So today's presenters include Bobby Samuel with Anthem, one of the creators of this tool, Tashfeen Suleiman with CloudMedX, and thank you, Jim, for kicking us off. I'd also like to thank Melissa Garrett for bringing us all together. She's here today. She's likely somebody that many of you know in local government, so feel free to ask questions as well. I'd also like to welcome and thank Jeff Eager from Anthem for joining us. And again, my name is Randy K. Stevens. I'm your technical host, and I will be looking for your questions on the system so that we can go ahead and make sure we're asking what you need to know. And with that, I'm going to turn the presentation over to Bobby Samuel to get us started with sharing information about the tool. One moment. Bobby, you should now have the rights to the presentation.
Great, I do. Let me share my screen. So good morning, everyone. Thank you for taking time to join us this morning. We're humbled that you would you join us and that you would listen to us as we walk through this and we share the work that we've done here. And the other humbling part of this is that you're in public service and you serve constituents, and we are some of those constituents. Both Tashfeen and I are California based. And so we know you have difficult decisions that you are making, and you're constantly balancing or running through the calculus between health and safety, economic, mental, and then economic sustainability and mental wellness. So just thank you for your public service, and we are the beneficiaries of that. So it's humbling to present to our leaders. So I'm at Anthem. I'm part of the team that's based out of Palo Alto. And we do software engineering. And during this time of COVID-19, when that struck, many of us were paralyzed. And so what we did is we thought, instead of being paralyzed, what can we do? And we were watching the news, we were watching all the things that were coming out. And one of the things that we observed was that a lot of people, a lot of companies, a lot of government organizations, private, were pulling together information, and they were all doing the same thing, all pulling information together, and then to the point that some of the representation was even hand drawn. And we thought, man, we can help with this. We can do this. We can do this more efficiently, and we can do this cheaply, and just do this as a public service and give this away. And so that's where we started. And I'm going to walk through a couple of things that you're going to see today. And just to help you get oriented, C19 Explorer is what we're going to start with today. So this is a publicly available, freely available tool. There will never be a charge for it, and it's always getting better. Every day there's new things that are coming onto it. There's new metrics, there's new data, and it's updated every 24 hours. And Tashfeen from CloudMedX will share that in just a little bit. But we're going to walk through that tool first. In addition to that tool, what we have is on top of that stack, we've also built for Anthem, people that are Anthem, groups that are Anthem health plan customers, whether it's state Medicaid or Medicare, or it's an employer group that's part of our family or portfolio. We've given them a view that's very specific, and we call that C19 Navigator, and it includes their membership, their employees, and as they're making decisions on reopening and where to go and as they're looking at how their workforce is scattered, not only just throughout California, but potentially throughout the United States. For non-Anthem customers, we've also created a view that is called C19 Privilege. So this is a password protected lockdown version of C19 Explorer. And where this is being used is where, for example, the state of New York has very specific information about their constituents that they don't want to make public. They don't want out to the media. They would like to keep close at hand, but use it as part of decision making. And instead of spending the dollars to build these dashboards, to pay for analysts to go through and to aggregate, organize the data, we're doing it for them and pulling it up in through the privilege view. And that has several more features, including scenario builders, goal settings that are much more complicated, and build upon C19 Explorer. So today, in our conversation, we're going to walk through C19 Explorer, and then we're going to walk through C19 Privileged. And what we'll do is we'll bifurcate the two, so you see here's what's freely available, and then you'll be able to see what's actually out in the marketplace. So with that, C19 Explorer is, let me figure out how to share my next screen here. C19 Explorer is, here we go, there it is. C19 Explorer is freely available, so I'm just going to open up my browser, my web browser, and it should be on the screen now. So in your web browser, just type in c19explorer.io. And to be clear, C19 Explorer, or this tool set, this is what you're about to see, is automated. It's an automated set of capabilities. There's little to no manual activities going on in the background. Everything from where the data is being grabbed to what is being displayed on the screen. It all happens every 24 hours. It's updated. As you can see on my screen, it's about 14 hours ago when the data was last updated. So we'll walk you through this in just a moment, but I want to orient you to the site. What we've set up here is it's focused on C19. However, there's life beyond C19 in our mind. We were creating this for something far beyond in hospital capacity and redirection of care and helping people make decisions on where to go. And C19, COVID-19 struck, and it was easy enough to pull it here into this visualization. The team worked day and night and for many hours, gave up vacations, gave up weekends to put this together because they felt like it was the right thing to do. And I do have to give a huge shout out to Tashfeen Suleiman and his team, CloudMedics. Their team has access to, so what you're about to see, there's no private information in here that is like Anthem membership or health plan specific. This is publicly available data, and some of it's private data, but it's been cleaned or scrubbed so that it can be put into this view. And then Tashfeen, what I'm going to do is, Randy K, if you could set up Tashfeen to be presenter, and Tashfeen will start sharing his screen. And what we'll do is we'll walk you through some of the site, the information that's here, how to look at what's across the top menu bar, and how to navigate the site itself. But once again, this is the freely available one, and you can go to it and browse and zoom into your counties and other such things. So Tashfeen is the CEO of CloudMedics. They're a group that we've partnered with to do other things at Anthem. And in this, we put our heads together and thought, what can we do that's meaningful and that would be impactful, and that would help people? And this is what we came up with. And so we're excited to walk you through this product. So the other thing too, as we walk through this, if you have questions, we'll be watching the question bar or the question chat area. We'd like for this to be interactive, so please ask. And we've also got our product owner, who's Jeff Eaker, who's on the line as well. You can influence the direction. In all honesty, we're taking feedback, and in a couple of weeks, that feedback actually shows up in the tool. There's been questions that people have asked. For example, you'll see somebody asked a question about, I'd like to plan my scenarios. Well, you'll see that in the privilege view in just a moment. So we take your feedback seriously. It's important to us to make something useful that people can get some traction out of. and that it helps us. We're here to serve you. So with that, Tashfeen, I'll turn it over to you.
Thank you, Bobby. Can you see my screen and hear my voice?
Yes, we can. Thank you so much to both Bobby and Tashfeen. Bobby, I appreciate the transition. This is Randy Kay from ILG. I just want to share we have received a question from one of our participants asking for the kinds of information that's available between the privilege set versus the publicly available set. So I assume you'll be discussing that, but I just want to let you know that a question came through.
Yes, we can take those questions. If it's okay, can we do that at the end? Or do you want it to be more interactive?
Whenever you feel it's appropriate, I just want to let you know that that question came through. Thank you.
Got it. Perfect. So I'll say that question because this come up. So in the public view, it's data that we're gathering from state, county, community, and nationwide level. The privileged data can be your data, so you will have the ability to upload your data, and we will bifurcate the privilege view so that you get access to both the public data and your private data, wherever you're getting the data from. So it's personalized and customized to you. Nobody else will be able to access your data. So we'll create a version of this tool that is only available to you, and the models can be fine-tuned and tweaked based on your models or cities or counties. Does that answer your question?
Thank you.
Great. So my name is Tashfeen. Thank you for the opportunity to come and present. We're humbled to be in this stellar group of people who are actually in the decision-making seats and have the huge responsibility of taking care of lives and reopening the states. I got to give a shout out to Bobby because he's cheating today. He's on vacation and he's working today. So I'm going to give him an earful. But we're in interesting times, and it just shows the call to action that we're all making in order to put these tools together and serve and rise up. So as a response, the C19 Explorer is a partnership tool that we've built with Anthem. And the idea was, COVID has struck, now what can we do? So the initial version of the tool was built around virus prevalence and the color coding states based on risk and how they're able to handle the surge. So number of hospital beds, ICU capacity, etc. So for example, in area you have the virus and you have enough capacity to deal with the virus. But over time, as the economy started suffering and jobless numbers came up and civil unrest started happening, we added additional tools. So we're getting data from over 100 sources all across 3,500 counties across the U.S. And we've segmented them into different groups. So the first one is public health, which is how widespread is the virus, number of death cases recovered, positive test rates, daily new cases, and the availability of resources to tackle the disease. So that would be number of ICU beds, hospitals, etc. So the color coding can be viewed nationwide, but can be drilled down to a state level and community level and county level. The second group is hospitals. So how are your hospitals fine-tuned? And my system is taking a few seconds to load due to the VPN. So the second view is hospital view. So how are the hospitals tuned to manage the surge and take care of the patients coming in? The third is economy. So how are joblessness numbers, unemployment numbers, people are getting furloughed, etc. And then additional information around social, how is foot traffic being impacted. We saw a certain surge over the last few weeks due to the protests. So we saw a little bit of an uptake in foot traffic, and so we'll go over that in detail as well. And then preventative around how fast is the virus moving? Are we doing enough tests? Are they keeping up with the demand, etc. So this is the center map view. On the left, you will see top areas that have high number of cases, and this keeps on changing on a daily basis. Like we said, Bobby said, we update the data every 24 hours. And based on the highest infection rate areas, the states or counties keep on updating. Sources of data, what precautions coming from CDC, White House, states should take, basic needs, and we keep on filling the left panel with additional insights. So I'll start with California for the public health section. So as I view that, the location, it sort of zooms in. You see total number of cases, that's positive test rates, daily new cases. For certain areas, we're getting reliable data. For areas we're not getting reliable data, we show either a dash or not available. Just because we're a pass-through entities, we're getting a lot of data, we're analyzing, and we're posting it on our dashboards. So we want to make sure we're getting data in the right formats. So that big California, you can see total population, total at-risk population, total doubling time. So some of the numbers, everybody's focused on the RT value, which is the growth number of the virus. But another important factor would be the doubling time of the virus. So how many days does it take for the virus to double? And that's always a positive trend, because it was 14 about a month ago, but it's gone to 31, which is always a good sign. Fatality rates, a number of days to recovery, predicted growth rate for the next 45 days if we continue with the shelter in place is also in a controlled manner. And at the bottom, you can see number of cases. And as you can see, we sort of flattened the curve in the last few weeks, but then it's sort of rising up again because of the foot traffic movement, protests, and people are venturing out and basically getting shelter in place fatigue. And you can see the monthly trends and see, are we truly flattening the curve? Is it month over month rising? And then you can also see how the last 6 months are faring. So you can see the number of cases have risen over the past few months, and we're still in the process of flattening it. Number of deaths, number of total tests that are being done, and this is data we're getting from across different states and counties on the number of tests that are coming out positive. And then daily new cases, which are you can view these as daily new cases or moving averages, whichever metrics that you're looking for. So again, you can do this by 30 days, by 6 months, and trailing data as well. The next field I want to talk about was hospitals. So within hospital, we can see how many beds are available, how many ICUs, how many ventilators. How many people are hospitalized? What is the hospital utilization rate? And again, this is an important factor. As you can see, certain states are in red, certain are in yellow, based on, again, how big is the virus surge in that area, and what is the estimated capacity for that hospital to deal with that influx of patients. And in the scenario builder, you can, which is in the privileged view, not in the public, but in the privileged view, you can actually estimate out 12 weeks. Where is the virus going to expand and spread, and what are the available resources that the hospital have in those communities to tackle the virus? So you can build in the scenario builder. I'll show you how that works. So I will pick up a county, the Santa Clara County, to sort of dive deeper. Instead of a state view, we can look at a community and county view. But feel free to let me know if there's any other counties that you would like additional information on. So again, at the county view, total number of beds, hospital utilization, et cetera, is viewable. But you can also view this at a per hospital level. So click on individual hospitals. You can see similar information available. And again, this can be used as a public resource utility. So if you're a patient, you're trying to get to a hospital and ER, either for COVID or non-COVID, you have the ability to look at this dashboard and see which hospitals have the capacity to take in additional patients and turn them around fairly quickly, as opposed to keeping them waiting, which of course increases the risk of infections, etc. So stepping back out, economy, the numbers are getting a little bit concerning, and we're getting data from the Department of Labor and other sources, and we can see that there's been a slight spike in the last month of April. We've actually gone by about 7 or 8 points in the unemployment claims numbers, and the May's numbers are actually touching 15 to 16%. But there was a rounding error that the Department of Labor had in May, so we're holding off on updating May's numbers. But as soon as they rectify the issue, we'll start pushing those numbers as well. So again, you can see these numbers by different counties and by different cities, and we're pulling this data for different areas. The next one is social. Within social, we're tackling a lot of data for mobility. So we have, through our partners, collecting data on social foot traffic using anonymized mobile tracking. And overall, we saw that the overall community mobility has increased, but because of the protests, the foot traffic in recreation and in retail sort of went up as people sort of ventured out. And you can also see that there's this shelter-at-home fatigue that's setting in people. So they're starting to venture out more and more. And again, you can view this as 30 days, as 14 days, and as other moving averages. We're collecting a lot of data from CDC, Medicare, and other sources to figure out how the mental state and the social determinants of health are improving or worsening during the pandemic. So, but again, within the county of San Mateo, the number of people who are available, who are dependent on food stamps and are insecure households, that's about 10% within the county of San Mateo. We also have kids that are dependent on hot meals, and they're at risk because their schools are closed. We'll put on those numbers. Drinking percentage based on number of buying patterns of alcohol and beer from different locations, that's gone up by about 5 or 6%. Suicide rates and age. Yes.
I'm sorry for the interruption. I just wanted to let you know we've got a few questions coming in, and if you wouldn't mind, I'd like to ask them so you can help tailor the presentation to some of the comments we're getting. We have a question. We'd like to see specifically Orange County. If you could go ahead and perhaps zero in there at some point. And then we also had another question related to any sort of unemployment data and if it's disaggregated by race or income. Do you have any of those particular layers? And while you're thinking about the answers to those questions and perhaps shifting over to Orange County, I would like to welcome the counties of Placer, Glenn, Fresno, Santa Barbara, Riverside, and Marin. Thank you for joining us today. Please make sure you're asking questions that help you think about how to use this tool for the communities you serve. And I do see representatives from Pacific Grove, La Habra Heights, and Anaheim. So thank you for joining from those particular cities. And just feel free to ask your questions and let us know what you're thinking about this tool so Tashfeen and Bobby can present and answer your questions directly.
Great. So I'm pulling up Orange County data for social, and within social we can look at mobility data and certain other things. Is there a particular area that you wanted us to focus on within Orange County?
They weren't specific, but if you'd like to ask, I'll go ahead and let you know when I get that question directly.
Got it. So I'll quickly go over some of the Orange County numbers, cases, deaths, hospital utilization rates for the county. If there's any interest, feel free to stop me, and we can do a deeper dive. So within Orange County, we have some interesting numbers on utilization and hospitalizations, economy and joblessness numbers. Again, at 13%. But these are April numbers. I think May's numbers would go about 15 or 16%. And then in social, sorry, what was the second question? I think that was related to social determinants of health.
Sure, thank you. There was a question related to unemployment data specifically, and if there's any sort of breakdown for race or income. And as far as the question related to Orange County, they were looking for any data specific to the Anaheim area.
Gotcha. So we do have a lot of data on income levels, job tiers, and others, but that is available in the privilege view. We had initially had that in the public view, but because of certain issues, we've decided to put that in the privilege view. But that will be available in the privilege view. I can give you a quick snapshot of what that would look like. So if you click on So this is the old UI, and we're transitioning the privilege view of the old UI into the scenario builders. But for purposes of this demo, as you click on any states, we actually have numbers for income distribution by each state here within businesses and counties. So we actually know how many people within a county are employed in what tiers. So our tier definition is based on CDC's definition of frontline staff being hospital workers, doctors, cleaners, and food delivery and grocery personnel. And then tier 2 would be anybody with an occupation and infrastructure, so your maintenance, repair, and other areas. please hang on one second. Sorry, that was my son waking up asking me questions. I apologize about that. So tier 2 would be your maintenance workers, repairmen, construction workers, etc. And tier 3 would be people who are in tech or cloud-based occupations and have the ability to work from home. So we know within each tier how many people are employed in each area and how many people, what is their median income, and you can distill this by state, by county, and by community. We can also distill this by race. But that's going to come in the privilege view. So we're in the process of transitioning this old view, which we put together very quickly for our proof of concept, into this view. So this will be coming in on Friday in the privilege view. Did I cover both questions, or was there a third question as well?
I think you've done great with both those questions. There was a broader question about understanding the city level data available. And so I think when you were able to cover more about Anaheim, that was helpful. If anybody has any questions related to that, please go ahead and put them into the chat box, and we'll make sure that Tashfeen and Bobby understand what it is you need and what kind of questions you're looking for answers on.
And so this is Bobby. One thing is, Tashfeen, before you continue. So what we're showing you now is the freely available view. This is the public view for C19 Explorer, and then Tashfeen for a moment flipped over to a more sort of privileged view. So some of these things will fit. I know we're going to be bouncing back and forth. Normally when we present this, we talk about C19 Explorer, then we take a pause and we talk about C19 privilege. So as we jump back and forth, just try to kind of keep that in mind, that there's C19 Explorer, but then there's a privilege view as well that has much more detail. So we can get into that as well, but just try to bifurcate that in your minds.
Thank you so much, Bobby and Tashfeen. We do have another question, and perhaps this relates more to the privileged view. If there's a policy that masks are mandatory, can you see any sort of data changes, or the impact of that policy in the data?
Yes, so within the social mandates, we're pulling a lot of data at the local ordinance and state level, and this gets updated once a week. But we do understand that at each city level and each county level, those policies may change. So in the privilege view, you will have the option to update those mandates yourself, so that your constituents in the privilege view will be able to see your mandates and ordinances. Right now, we're pulling data at the state level once a week and putting those in there, but you can go down to city level or county level in the privilege view as well.
Thank you.
Okay, great. So the last thing we wanted to touch on, the public view, was the preventative. How many tests are being done? Is enough being done to cater to the virus? So one interesting point is the adherence to shelter in place. This number is a little concerning. It was about an average of about 20% by each county, but that's dropped down by 10 points. Again, going to shelter in place fatigue, and people just wanted to venture out. And so we're tackling a lot of the social mobility and foot traffic data to see how how it relates to increased prevalence of the virus. And so we saw similar trends like this in the Arizona data 3 or 4 weeks ago. And now you're starting to see surges within certain parts of Texas, certain parts of Arizona. And so again, the two numbers that are very predictive are adherence to shelter in place and adherence to social distancing. And so using mobility data, we can track a lot of these things and then predict which next area is going to see a surge and how they can plan for it. So there's no more questions. I can quickly show you what's coming in the privilege view on Friday. And then switch context.
That would be great. Thank you.
Okay, so what's coming is the ability for anybody to build a scenario. So I picked up San Mateo, Santa Clara as a county, and within Santa Clara, we're automatically pulling in, like I mentioned, tier 1, 2, 3, 4 job numbers of how many people are employed in each tier. And as a county official or a state official, you have the option to say, I want my tier 1 workers, which are your healthcare workers, your grocery delivery, and essential staff, to be 100% available in the workforce. So if you do that, you can say, I want them to return to work 100%. Tier 2, you could say, I want 20% of the workforce to come in. Tier 3 could be, there's an icon that's coming here. Again, 20%. Tier 4 could be 10%. And I want to restrict mass gatherings, which means you're not allowed to congregate in the cafeterias. Initial business travel is restricted. Education facilities are closed. Stay-at-home order is enforced. And when you run the scenarios, you will see a dotted line of, if you reopen, you could see a certain surge, but then it will sort of taper off. And, you can see, what are the risks to your constituents or your employees, and what can be done in order to safely reopen. You can also set goals and trigger points and say anytime the caseload within my area crosses 500 or 5,000 or 10,000, it should trigger an alert and force me to do something. So as those triggers get switched on, the circuit breakers get switched on, you can add additional filters or add additional restrictions to be enforced so your workers are safe. Again, this is in the scenario builder in the privilege view, these are some data sets that we'll be tweaking around, but you will have the ability to add more things here based on your local ordinance, and we can build models around that and make it available for you so that your constituents can follow through those things. So this is for around return to work. We are building additional scenarios around testing to reopen. So again, taking Santa Clara's numbers, based on the CDC guidelines, you need to get tests done every 2 weeks. So we select every 2 weeks for your essential workers. So essential workers would be your personnel in hospitals, and they need to be tested every 2 weeks in order to make sure they're not sick and they're not making others sick. Non-essential workers can be 4 times, and everybody else can be 6 times based on how they're symptomatic or not. So based on this, we need to do about 75,000 tests a day in order to safely reopen and cover everybody who's at risk. But the reality is we're only doing about 5% of that right now. So we need to dramatically increase our testing capability and ramp up. Another interesting number that we're pulling out is the number of contact tracers required to trace and contact the people who are getting infected within each county. So for the county of San Mateo, that would be 115. So again, you can tweak these numbers and get interesting insights on some of the scenario builder tools as we manage some of this. We're also providing surge predictions, so you can predict 6 weeks out, 12 weeks out, and see where the virus, based on current trends, current restrictions, current social distancing effectiveness, where the virus is going to head in the next few weeks within your county, and are the hospitals capable to handle that surge or not? And if not, some hospitals are also using this tool to increase their capacity based on the increased demand. So we have a few partner hospitals in Houston and Arizona that were looking at this tool, and when the surge did hit those areas, they were aptly prepared. So with this, I'll stop and take any questions.
Hi, Tashfeen, it's Melissa with Anthem. One of the questions that I've heard and has come through here, and you hit on it a little bit about contact tracing. Is there something in the future that you all envision or see this tool being able to help with contact tracing?
I can take the first part, and I'll let Bobby take the second part. So within contact tracing, one of the features we're providing is hot zoning. So you can use this tool to hot zone trace and see which areas are red, which areas are green. So essentially, if you're a private citizen, you can look at this and say, hey, I want to go to Walmart or Costco or get my groceries, and you want to sort of avoid counties and areas that are hotspots, and try to be safe from that perspective. So one view would be that, but from the privilege view, we do have a capability to identify how many contact tracers are needed in a particular area to tackle the hot zones within a certain area and cater to the reopening process and also the personnel moving in and out, whether they're office personnel or people doing groceries, etc. But I know Anthem has certain tools that they can directly engage with patients using some of their mobile apps. Bobby, you want to take that question?
Yeah. Yes. And Melissa, just one thing before I answer that question, Anthem is using what Tashfeen is showing here. We're using this internally. We're overlaying it with a few other tools that we have. So, for example, we have something called Sydney Health, which is the mobile app that our membership within, so just our internal house account or health plan, like we call them, are being rolled out. Within that, we've put in, we're starting to add, or actually not, we're starting to add, we've added contact tracing modules that people can opt into and other things, and it's being phased across all of Anthem. We're also using this tooling that Tashfeen is referring to with our return to work strategy. So we're engaged with the whole COVID-19 Anthem's response team with putting together a return to work strategy and helping them make decisions by location. So it's not only contact tracing, but we're also pulling in HR type information, employee location, specific to different cities, who's within, what we have within Anthem is a commuting rule. So if you're within 50 miles of an office, you're considered an office worker. If you're outside of that 50 miles, you're considered work at home. Right now, we're all at work at home. So we're looking at mass transportation options around a city who's within 50 miles of a particular office location, as well as using the Sydney Health app and feeding data in on contact tracing. There's also testing data that we're able to pull in as well. So this information on Anthem health plan, like within our, when I say Anthem, I mean people that are, Melissa, like you and I, employees, and Jeff, like employees of the organization, that as they are tested, we have apps that we've deployed that they're able to say, hey, we've tested, here's the evidence of that, as well as who's using apps like Serenity, which is like a mental health support app, and other things like that. So this data, to answer the larger question, Anthem, I think the right word for it is dog fooding. I don't like that word because my dogs eat dog food and I wouldn't eat it. But we're actually like taking our own medicine here. So we're our own first customer. We're using it actively for our return to work strategy. So everything from contact tracing to who's using like mental health apps to pushing out useful tools to people based on location, it's all part of our return to work strategy and how we're monitoring that.
Also,
so I know that was a much
Bobby,
longer. Go ahead.
Yeah, go ahead. Yeah, and to add what Bobby is saying, you may have employers that are multi counties. They have offices in multiple counties. Using the hot zoning, you can look at the tool, figure out how many essential personnel are in which counties. And if they're red, maybe divert the personnel to counties that are safer to open now. They may be green areas that can open up first, while still keeping the essential personnel on staff, and continue from that perspective. So in the privilege view, there will be many scenarios that we're doing for return to work that look at those parameters.
Bobby,
Thank you.
Sorry, Melissa, this is Randy Kay. I just thought I would ask, given that you've brought up the use of kind of mental health apps and other things, can you just clarify, how this tool really protects kind of HIPAA and for the users and all the data?
Yes. So within what you're seeing now, well, what you were seeing on the screen from what Tashfeen is presenting. So remember, there's a public view and there's a private view. So if you remember the PowerPoint slide I was presenting earlier, the public view is desensitized data, it's been scrubbed, and that's what's available. In the privilege view, which is what Anthem internal is using, as well as the navigator view, that is password protected, locked down, that only people within the organization have access to. So as far as HIPAA information, we are not pulling in information that would be considered private, other than what the information is that we have as a normal course of business. So from an employer perspective, we know what people are paid. Like, we have that information. We know what their health plans are. We know what their coverage is. We know whether they've had a test or not. or if they've been found COVID positive. So we're being very careful as we go employer by employer to make sure that we're not divulging information. As you know, it's HIPAA first. Privacy is first and foremost the most important thing to us. I know that what you're looking at here is sort of innovative, if you will. We start from a security first, privacy first focus, and then expand from there. So at the very core of what we do, that is locked down, and lawyers and legal folks are looking at this before any bit of data ever shows up in there. So that's where we would work with different organizations, but even our own internal attorneys would want to look at it to make sure that we pass all the HIPAA privacy things, not just by letter of the law, but also in spirit of the law, that we're protecting people in the way that makes the most sense.
Thank you for answering that. We received another question from one of our webinar participants asking about any specific data related to Native American communities. Is that something that's part of this particular tool or potentially a future version of this tool?
Tashfeen, I'll let you answer that one from the data set.
Yeah, we actually have a lot of data on gender and ethnicity. We are being a little cognizant of presenting it in the right way, especially with the current unrest. We don't want that to be misunderstood. So we're working with some of our team members and Anthem on what is the best way to present this without identifying a red flag in certain communities. So we have that data, but we're being cognizant on how to present it.
Thank you. One of the questions I think is about how to, access the privileged sites versus the public site, and how would, an agency go about creating the opportunity for them to have access to that kind of deeper data?
Bobby, do you want me to take that question?
Yep. Yeah. So what we do, and Tashfeen, let me start. So with what we're normally doing right now is we first want to scope out what it is that you want. So we'll spend some time with any organization. We want to scope out what it is that you want, what it is that you need. We want to talk with you through that to understand that, because there may be alternatives, because someone may say, I want a skilled nursing facility for just my city, and I want, specific information about it. So some of that we'll have to work with you to go collect. Some of that we may already have. We'll have. So we want to talk with you through and scope it with you, and then very quickly work with you to deploy that. To get access, if you want to see the privilege view after it's released, we can give you a password access to a generic version where you can have a scenario builder or such for a short period of time. But that's in essence, it's by organization. We will work with you. So Jeff Eaker, who's on the phone, as well as someone from Tashfeen's team, would spend time with you scoping out what you need. But if you just want to play around for a little bit in the dev version, knowing that it's in development, knowing that it's not ready yet, we're happy to give you just short-term access to that, as long as you're not using it for decision making. If you just want to click around. And the other thing I have to remind you is we rapidly iterate on features. So I use this word, but every day the goal is, as we put new features in, the tool needs to suck less than before. So I say that kind of tongue in cheek, because if you saw the original version that Tashfeen had, which was like the Google Maps view of how things sort of fit together, and then you've seen like the new iteration of it. And so we're already brainstorming about iteration, 3.0, if you call this one 2.0. And then every new feature that shows up on, every other week or so, every couple of days, there's something new that's coming out. The criteria is, one, it has to make the site, but it has to be accretive and improve what's already out there. So long-winded way to say, if you're interested, please, through Melissa Garrett is on the phone from Anthem. If you would contact her, she will get you in touch with us, and we will spend the time with you to understand your needs and make sure you get what it is that you're looking for. And Melissa let me take just a moment and allow you to, just so people can hear your voice as well, and you can give out your contact info or share any of that.
Yeah, thank you, Bobby. So I am the Government Relations Director for Anthem Blue Cross here in California. So for the cities and counties and our special districts who are on the line, please do reach out to me if you have questions after. And if you do want to work with us on kind of forming the tool for your use, we'll be sure that my contact information is in the meeting materials if it wasn't already, so that you'd be able to get in touch with me. But it's also, my email is Melissa, MELISSA .Garrett, GARRETT @anthem.com.
Thank you, Melissa. I have added your email to the chat box so people can have it there. I'm also currently adding the full presentation as a PDF file to the handouts, and we will send a follow-up message to all participants on this particular webinar so that they have information from today's presentation.
I have one other question that came through here. This is Melissa, and it's asking about, would the software tool be able to display hotspot locations by risk pool? So for example, populations or physical locations more at risk for unique cancers or other health problems that may identify external risk factors.
Yes, that's coming in the privilege view, where we look at COVID plus comorbidities based on certain zip codes and generate risk profile based off of that. So that is coming in the privilege view.
Great, thank you.
We do have a question that came through from a participant asking about kind of the ability to kind of look at statewide kind of policies related to masking rates by counties and kind of doing some sort of comparison. You know, is that something that you could do where you can compare between counties?
We have had this request from others. We haven't built that in, but in the privilege view, we do have a function where you can compare different things together. We can certainly scope that out and build it if there's enough high demand for it.
Thank you. I just would like to remind the audience, if you have any last questions, we're coming upon the conclusion of the webinar, so now's a really good time to get in any questions about how you can use this tool to the benefit of your community. All right, we did get a question, and just for some of those who were able to join, but perhaps joined just a little bit late, how, Melissa, can you remind folks about how they can get access to the privileged view?
Yeah, so I think emailing me is the best way, and that way, and I think Randy, you put that in the meeting materials that are attached to this webinar. So email me, and so we can talk about what your specific needs are and questions. And then I'll work with Bobby and Tashfeen to be sure that we'll see how we can make that happen. And then, as Bobby mentioned, if you just want to look at a demo version that doesn't necessarily have privileged information loaded, but you can play around with some numbers and see what's accessible there, email me also, and we'll get you a temporary password for that.
Thank you so much. You know, while we're waiting for some last minute questions to come through, I do want to just recognize the counties and cities that we can see who are participating. And I'd also like to recognize that we have participants from FEMA, the Public Utilities Commission, and Department of Transportation here, which just truly demonstrates the power of this tool and the impact it can have on a variety of organizations because of the kind of information CloudMedX and Anthem have pulled together. There's so much utility and possibility and potential of using this tool for a number of reasons because of COVID and beyond. And I'm looking for any last minute questions that have come through. In the meantime, I'd like to invite any of our panelists, Bobby, Tashfeen, you know, Jeff, Jim, Melissa, to share any kind of last words about this tool or about their organizations.
So I can wrap up here with this if there's no further questions. But we're just to reiterate, we are humbled and honored to be speaking with you. We never created this as a sales opportunity. Neither Tashfeen, Jeff, or I are in the business of sales. We're in the business of building things that are useful. So as you have feedback, whether it's critical or positive, we're here to listen, and we're humbled that you'll even take 5 minutes to look at the tool. We know that your schedules are busy and that you are making difficult decisions. And on behalf of your constituents, thank you for the work that you do. It can't be easy, and it has to be wrought with lots of consternation. So we are thankful and we are humbled to be presenting to our leaders today. And it's an honor to have spoken with you today. So if you have more questions, please reach out through Melissa Garrett, and we will swarm around your needs. We know that you're in a difficult decision-making process, and we'll honor you through that, and we'll work quickly to give you what you need to make decisions for your constituents in your areas, whether it might be comparison type things, whether it might be new data sets. We're here to serve you. So thank you so much for the time today.
Yeah, and this is Jim Manker. I want to reiterate, thanks again. I love that phrase, swarm around your needs. That's great. Want to again thank you, Randy K. Stevens, for providing the platform here today and hosting us really, really well. And the expertise that we received from Bobby and Teshfeen and Melissa and Jeff. Just thanks for this tool. What a fantastic just resource for counties, cities, special districts. And again, just want to highlight the partnership between CSAC, the Institute of Local Government, and Anthem. We love our partnership with you guys, all three of you, and let's just keep building a better future. Stay safe out there, people, and like we said, we'll send out a slide deck of this presentation today. So again, thank you so much, and have a great day. Take care.
Thank you, Jim. Thank you, Anthem team. This is Randy Kay with the Institute, and would just like to share one last screen with contact information. And then each of you now has that PDF file of the slide deck, so it is yours to see and to share with your communities and your agencies and key staff. Thank you again for participating, and I look forward to seeing you on a future webinar in partnership with CSAC and other organizations. For any additional COVID information about local government, please refer to CSAC's COVID page or to the Institute for Local Government. And with that, we will conclude our webinar for today, and thank you all for joining.